Your time is 5:51. We continue our coronavirus coverage this morning with a good question report. One of our viewers asked, are we learning more about the long-term effects of this virus? Here's what we know this morning. Just this week, doctors released a new report. It found 55 long-term effects in recovering patients. The most common include fatigue, headache, attention disorder, and shortness of breath. The CDC says about 35% of those infected will have symptoms at least 2 to 3 weeks after their positive test. That jumps to 47% for those 50 and older. Keep in mind, for some, it will be even longer. Now we want to talk about long-term damage from those symptoms that so many are experiencing for weeks, even months. First, your heart. The American Heart Association says the risk of COVID-related heart damage is far greater than previously thought. In fact, damage is evident in 20 to 30% of hospitalized COVID patients, and it's contributing to 40% of COVID deaths. There's also concerns about patients' lungs. The Mayo Clinic says the type of pneumonia brought on by COVID can damage the tiny air sacs in our lungs, which would result in scar tissue, creating lifelong concern. And lastly, your brain. The Mayo Clinic saying COVID can cause strokes, seizures, and increase your risk of developing Parkinson's and Alzheimer's as well. Now, all of these symptoms are why doctors are warning it's so important to protect yourself as best you can from getting the virus. Wearing your mask, social distancing, and getting vaccinated will help, but doctors say mental health is important too. If you do get COVID, do not stress about long-term effects right away. Keep in mind the majority of people are fully recovering from all symptoms after 2 to 3 weeks, despite, again, about 35 to 40% having those remaining symptoms. If you have a good question, be sure to email me at goodquestion@kctv5.com.